Hello everyone, welcome back to our VlogMass day 18. So for our day 18, our topic is how to get pregnant with PCOS and stay pregnant. So a lot of people with PCOS, polycystic ovarian syndrome, find it difficult to get pregnant and then stay pregnant till the end. Most times people think it's getting pregnant that is their trouble. No, their main issue is staying pregnant. That's carrying a successful pregnancy till delivery. And it's one of the easiest challenges, at least on our programs. It's one of the easiest and the most common challenges we've seen, even though I've heard a lot of people say, my doctor said you can't treat PCOS, you can only manage it. Even I had a testimony even yesterday that one of my clients, her PCOS had finished and then now she's pregnant. So yes, say hello. We'll do tea later. Say hello. Say hi. She's hungry. All right, so we'll do tea after here. All right, let's tell them this one first. Remove your hand from your mouth. Her teeth hurt so bad. So for the PCOS patients, there are just a few things to do that you can conceive and stay pregnant and carry your beautiful baby to term. So first of all, for those that their PCOS comes with a lot of weight gain, you have to manage your weight, eat healthy, do exercises as you come. Do exercises once your weight is in check, and then your metabolism. A lot of them suffer with constipation, they suffer with gases and all those kind of things. Sometimes when I say rest, a lot of people ask me, how do I rest when I'm working, I'm doing this? You don't really need to, I don't know how to put it, but you have to manage the stress so that you can rest a bit. There are some things that are not top priorities that we can forget them and then focus on our energy, especially for a woman who is trying to conceive. Sometimes get up and come, let mommy carry you. Come, let me carry you. So sometimes you just need to put more effort in this you're trying to conceive. Some people say, I'm tired, I don't want to do everything, I've done everything. And when you really ask them, they've not really done anything apart from visiting the doctor, taking pills. They've not really taken charge of or control of their own system, their own body, like eating healthy. Most times when you go to the hospital, the doctor gives you Chromium, and Chromium is not the solution to things like PCOS. They give you Chromium to induce your ovulation, and most of the PCOS patients, their eggs have grown so big that they have liquid inside. They are not going to ovulate. So if you test them of ovulation every day, it shows positive from the day they are menstruating to the day another menses starts. Some of them, their egg qualities are very, very low. That's for those who are not fat. There are some people with PCOS that they are not fat. They don't have any symptoms. Their egg quality is very low. And they are trying to induce ovulation in a body that has so many issues. The first things to do is eat healthy carbs. Some people say, I've cut down on my carbs, I don't eat carbs again. No. Eat healthy carbs like brown rice, quinoa, potatoes, sweet potatoes, Irish potatoes. Take supplement, take healthy fats. We have a very customized plan for PCOS clients on my program. So if you have PCOS and you want somebody to guide you, you can send me a DM on my Instagram page at Fertile Moms, or you can go into the link in my bio, click on it, and then you'll be in my WhatsApp, and then we'll talk about PCOS. But for the basis of it, this is it. Most PCOS patients have vitamin D insufficiency. Low levels of vitamin D causes insulin resistance, ovulatory and menstrual irregularities. And most of the PCOS clients, you find this with them. But personally, I don't recommend vitamin D to them as a supplement. I include that in their meals. So because there are so many other important supplements that I recommend to them. So vitamin D, I just include that in their meal so that it will work very well in their system. And it brings lower pregnancy success rate. So take foods that are rich in omega-3 fatty acids. You can supplement on for my PCOS clients, I give them cod liver oil because it absorbs faster in their system. So you can take things like a chia seed, flax seeds. Chia seed and flax seeds are very high in omega-3. You can grind them and add in your oats. You can take them in smoothies, and these are the things I do to my clients as well, so that they can have so many omega-3 in their system. And then I give them Chromium. I recommend Chromium to my clients because it helps with insulin resistance, it helps with acne, and support the body to ovulate very, very well. So if you're my client and you have a PCOS patient and you see Chromium in your supplement, that's why Chromium was recommended to you. And then I recommend Myoinosito for my PCOS clients. Myoinosito reduces acne, improves egg health, improves embryo quality, and increases fertility. It reduces the risk of gestational diabetes, and inositols are rich in fruits like grains, nuts, oranges. Oranges are really high in myoinositol. So sometimes I recommend myoinositol to my client and they say, I got is it the inositol. The inositol, when you take it so much, it affects your air quality. So that's why I don't recommend it to my client. A lot of people don't know, and a lot of people won't tell you. Some of the practitioners don't even know this. So they don't take, they just take the inositol. But myoinositol is really good for people with PCOS. So for PCOS, this is just a recap for them. You don't have to do so much for you to be able to conceive. And once my PCOS clients conceive, or anybody that have PCOS conceive, whether or not the PCOS symptoms are still there, it is good to stay on top of your progesterone, because PCOS patients 90% of the time have progesterone issues, and progesterone is the one that will guide your pregnancy. Once it's up, you will not miscarry. Once it goes down, you start bleeding or your baby stop developing. So first of all, I recommend Dufastone 10 mg. You take 1 in the morning, 1 in the evening, from the time you discover you're pregnant until you get to your 12-week mark. That's when you get to 3 months. Some people, because of their history and how severe their condition was, I used to recommend it to 25 weeks. So it depends on how bad yours was. And there are some people that I don't even recommend the Dufastone. I recommend the injection progesterone to them. And then this is the constant psychologist. I don't know if you can see it, but 400 mg. I recommend psychologist 400 mg. You insert this one in your anus in the morning and evening every day until you get to 12 weeks. And this is a pack of 15. So this is for 7 days, and then one in the morning, then it will finish. And this pack is about initially it didn't used to be so expensive, but it's about from 13 to 15,000 naira. It's a bit expensive, but for your child, I don't think it's expensive. In naira, it's about 15,000 naira. So I can't remember how much it's in dollars. So please, if you have PCOS, try to take major precautions. Don't leave anything to chance, and PCOS can be cured. It can be taken care of. Thank you, and I'll see you in a VlogMass day 19. Bye.